This is our Posture Pro, a really useful device for loosening up the thoracic spine. So really effective for treatment of any shoulder problem, neck problem or thoracic spine problem. How it works is you lay on it and the spinous processes or the spikes that stick out your back sit in that groove there, so it's much more comfortable than trying to use a rolling pin or something like that. The other benefit is because it's quite small, it's much more specific than a foam roller. The big foam roller will generally give you a nice thoracic extension stretch, whereas Posture Pro can really isolate each level and you can work individually from T12 all the way up to T1. And the final benefit is because it's nice and narrow, it doesn't push on the scapulars, which will support the thoracic spine as well. So we think this is the best tool for thoracic spine extension exercises. We'll place that on the floor. Eric, if you want to pop your head at this end and have a lie down on your back, what we'll do is we'll start at the top, just at the top of his neck. Often it's much more comfortable with a pillow, but you don't have to have a pillow. Rest your head back there, mate. And then he can just, the easiest way is for him just to lay there and feel that stretch over the Posture Pro there. To intensify that stretch, I'll ask him to lift his arms up and lift them up over your head. All the way up, and that'll intensify the stretch. And then he can bring his arms back up to my arm here, to vertical, and back over his head. Now as his weight distribution changes, as he moves his arms, he'll feel less intense of a stretch and more intense of a stretch, which is very similar to the mobilisations that the physios will do when they push on your back to loosen up this area. So say we've done about 10 of those. What I'll ask you to do now is move your body up this way an inch, leaving the roller where it is. That's it. And then perform that arm movement again. And you'll feel that target a slightly different area. You feel that? Yeah. Okay. So again, imagine we've done 10 or 20 of those, depending on what your therapist recommends the dosage should be initially. Slide up another inch. And we can work all the way up and down his thoracic spine. So that's from about the bottom of the ribs to the bottom of the neck. Now for some people, if you're very stiff and have had a lot of problems in your thoracic spine, the roller on the floor first up is too aggressive. So for those people, have a sit up, we can put some towel over it and that will reduce its intensity. And then as your thoracic spine starts to loosen up, you can slowly wean yourself off the towel and eventually be doing the roller just on the hard floor.